My professional experience supporting folks who are experiencing grief related to um, deaths related to drug poisonings um, is as a peer support worker predominantly. I work on a peer to peer level with community members to help them reach their goals related to substance use. So, when as a community we're experiencing that loss, or when the community member is experiencing a loss in their personal life, um, it's when I'm supporting somebody in that situation, it's really important that I remember that that loss is very individual. The circumstances that lead up to that kind of loss, in terms of poor policy, in lack of resources, those can be very similar, but this person's experience is an individual one. So it's important for me to listen to what they need in that moment to make sure that I'm caring for them in a holistic way, that they have a space to process their grief that's safe for them, that there's safety planning related to them processing their grief, whether it's going to trigger them to need to use substances as a coping mechanism. Do we have a safety plan around that? Um, and then also to create opportunities to share memories of the person that's been lost. Often with the community I'm supporting, the person who's been lost is living rough, or um, there isn't necessarily a funeral, or a funeral that's accessible to the person who's grieving them. So being able to create that unique experience for that person to have a sense of closure, or a sense of connection.